Hello, everyone. My name is Gavin, and today I'm going to talk about exercise and sleep quality. The article I picked is a systematic review and meta-analysis about exercise can improve sleep quality by Beno and his colleagues, published in 2018. Let's firstly talk about the background. Actually, there are many people who are suffering from the sleeping disorders. Approximately 30% of the general population experience the sleep disruption, while 10% experience both sleep disruption and the daytime dysfunction consistent with a diagnosis of insomnia. You might say, oh, it's just a sleeping disorder. It couldn't be too severe, ignored. The patients with insomnia are at higher risk of developing hypertension, atherosclerosis, and the acute mitochondrial infections. It is also strongly correlated with mental illness and adding an additional risk for depression as well as the suicidal ideation and behavior. Not only that, there are more complications associated with insomnia. For example, the risk of heart disease, the risk of diabetes and obesity as well. So now we know it is a very severe condition, but is there any treatment? Well, there are effective drugs, but the pharmacotherapy, like using the sleeping pills, it is a very effective treatment for patients with insomnia. However, the use of hypnotics is associated with increased mortality rate and the frequency of falls and hip fractures in the older adults. If you don't want those side effects, the cognitive behavior therapy for insomnia could be one of the choice. However, it requires you to go frequently and it is super expensive. So if you are looking for a treatment without any side effect and cheap, maybe the exercise will be the way to go. The exercise is a non-pharmacological therapy for insomnia. It is easy approach and costs less than any other treatments for insomnia. It has been confirmed that the exercise has positive effects on sleeping quality. The sleep onset latency means like how long you spend to fall asleep, and the total sleep time, the sleep efficiency, and insomnia severity. The epidemiological studies have been proved that the exercise is decreasing the complaints of insomnia, and there is a relationship between the lower levels of physical activity and the greater prevalence of insomnia. Now let's talk about the aim and the participants in this study. This systematic review and meta-analysis is aimed to examine the effectiveness and efficacy of exercise in patients with insomnia. And the participants, including those who are diagnosed by using any standard diagnostic criteria such as DSM and many other tools. All participants has insomnia-related daytime impairments. This research included patients of any age, sex, race, and setting, but exclude those with sleep apnea syndrome since it could be really dangerous. And by the way, this research included 9 studies with a total of 556 participants. The method. This research searched a whole bunch of resources to identify all randomized controlled trials that examined the effect of exercise on sleep patterns in patients with insomnia. All participants were diagnosed with insomnia using standard diagnostic criteria. Data on outcome measures were subjected to meta-analysis using random effect models. The Cochrane risk of bias tools and few other tools were used to assess the quality of individual studies and the body of evidence. The interventions were predetermined exercise programs. Interventions of any intensity, durations, and frequency were included. This study included exercise in combination with medications if participants in the intervention, and control groups were taking the same medication. Any sort of medication programs, massage therapy, or breathing techniques without a physical activity was being excluded. And then basically comparing the exercise intervention group versus the non-exercise control groups by measuring their sleep quality, sleep onset latency, total sleep time, and insomnia severity. The important result that they found, firstly, the sleep quality. The data from 6 trials comparing 361 participants that measured the sleep quality was included in this meta-analysis. The Pittsburgh Sleep Quality Index shows a significant effect noted in favor of the intervention groups after an intervention period of 8 weeks to 6 months. It hasn't shown a 2.87 points lower in the intervention groups. By the way, the lower score means more beneficial in PSQI. And secondly, for insomnia severity, the data from 2 trials that measured insomnia severity in 66 participants and had an intervention period of 4 to 6 months. All trials measured insomnia severity index, and there was a significant improvement in the intervention groups. There is 3.22 points lower in the intervention groups, and the lower score means more beneficial in the insomnia severity index. The take-home message will be the exercise can actually improve the sleep quality without any notable side effect in patients with insomnia, and it should be an effective non-pharmacological intervention. And that's it. Thank you for listening.